Hi, Dr. Alexander Tagva here, board certified neurosurgeon. I want to take a few minutes today to talk about something that I get asked a lot in my practice, and I feel like I never give a full, complete answer that I'm happy with because of the constraints of the time we have with patients in the clinic. Um, as you may know, in my practice, I'm a big proponent of something called spinal cord stimulation, which is a great therapy for patients who have chronic pain, who have failed prior back surgery or neck surgery, and who, despite these interventions, still have pain. We're starting to use it more now for other disorders, including patients who are not candidates for back surgery but still have back pain, or also patients with painful diabetic peripheral neuropathy. But in any case, what I often get asked by patients when I'm talking to them about spinal cord stimulation is they ask, well, is this therapy just masking the pain? And is it possible that I'm going to do more damage to myself if I have the stimulator because I don't know that whatever I'm doing is hurting me? And generally, what I tell patients is this: I say, well, short answer is no, and I describe it like this: that well, let's say you have a spinal cord stimulator, but you drop a bowling ball on your foot, or you put your hand on a hot stove. You're still going to feel it. Your body's still going to protect you, and so it doesn't erase pain, but what it does is it treats neuropathic pain. And so that's the short answer that I give patients, but I've always felt that that's a little bit unsatisfying. And to really understand the full answer to this, you have to kind of step back a little bit and think about, well, what is the purpose of pain? And pain is generally thought of as a warning signal, at least in my mind. And without pain, we would have very short lifespans. In fact, there's people genetically who have no pain receptors. And while that sounds great that they can't feel anything, what ends up happening is these patients generally die very young. And they do things like they could potentially bite off their tongue or do risky activities, which end up with leg fractures or other severe injuries because they don't have that warning signal. Um, that being said, in patients that I treat with chronic pain, the pain itself isn't warning us about anything. It's just something that's sort of ingrained into our everyday experience and sensorium. And because of that, it's no longer serving a purpose. And in fact, it's counterproductive because it encourages us to move less and we do fewer things. And so our muscles get weaker. And then as our muscles get weaker, we have more pain and we do less, and it becomes this self feeding cycle. And so when I talk about spinal cord stimulation, I generally talk about two types of pain broadly. One is nociceptive pain, and that is the type of pain that we talked about. Well, let's say you touch something sharp, or you drop something heavy on your foot, or you touch a hot stove. You feel pain instantly, and that sharp pain is called nociceptive pain. That pain is a useful warning. There's no therapy that sort of erases that, and in fact, we would never want to. The type of pain that we treat with spinal cord stimulation is something called neuropathic pain. And neuropathic pain is different because uh, the pain itself is actually the pathology. I think of neuropathic pain that the nerves themselves are malfunctioning. Sometimes it's because they've been exposed to some degree of chronic irritation or inflammation, or let's say someone had a prior back surgery and the nerve either was injured or never fully recovered or developed scar tissue. And so it just fires abnormally. So in that case, treating the pain is actually treating the problem. It's not masking the problem. And so um, I think that spinal cord stimulation is a great tool for those sort of patients. Now, one of the things that's sometimes difficult to unpack in the clinic is, well, does this patient have a nociceptive or sometimes a mechanical, which is similar type of pain, or is it neuropathic? And there's often some basic guidelines. So I think of nociceptive or mechanical pain as being sharp, sometimes related to movement or position, whereas we think of neuropathic pain as kind of a burning, gnawing, always present pain. The truth is, most real patients don't fall easily into one category or the other. They're usually a mixture of both. So, on patients who are on the fence about spinal cord stimulation, who aren't sure if it's mechanical or neuropathic pain, or I'm not sure, sometimes if we still want to treat them, we do what's called a trial, which we do for all spinal cord stimulation patients. And that's a simple outpatient procedure where what we do is we give a patient a little bit of sedation, and then under x ray with a couple of small needles, we put some wires into their back. And then over the course of a week, we test if this helps their chronic pain. Typically, neuropathic pain responds really well. And so if I have a patient who gets a lot better after spinal cord stimulator trial, then oftentimes I'm a little bit more comfortable saying, hey, look, we're treating a neuropathic problem. Some patients with mechanical pain can get better with spinal cord stimulation, but generally speaking, patients with neuropathic pain do better. Um, so that's a long answer, but I think a more satisfying answer to, does spinal cord stimulation mask pain? So hope you enjoyed it, and I hope this is helpful for you. Thank you.